When we think of scoliosis, the first thing that probably pops into your head is a curved spine. It seems pretty straightforward, right? But what if the problem doesn't actually start with the spine at all? Today, we are diving into a really fascinating approach called the Hyunga Meridian technique, or HMGT for short. And it suggests that the real cause of scoliosis and its solution might be found in a completely different part of the body. So let's just sit with that question for a second. Seriously, what if that visible curve is just the final domino to fall? What if it's just a symptom of a much deeper imbalance that started in your feet, or with your internal organs, or even along these invisible energy pathways that Eastern medicine has talked about for centuries? This whole technique, HGMT, challenges us to zoom out, look past the bones, and see this much bigger, more connected system. So here's how we're going to break it all down. First, we'll get into HMGT's totally unique take on what causes scoliosis. Then we'll unpack the core principles and this super important idea called the Hyunga axis. After that, we'll see how the theory is put into practice, we'll look at a real case study, and then we'll wrap up by thinking about what this all means for how we understand our bodies. All right, let's dive right in. The first big idea is just a whole new way of looking at scoliosis. Instead of seeing it as a problem that begins and ends with the spine, HGMT says, hey, hold on a second. The spine is often just trying to compensate for other things going on. I mean, just look at this list. It really shows you how wide a net this approach casts. We're not just talking about genetics or posture. HGMT looks at things you probably would never think of, like a slight difference in your skeleton you were born with, or maybe you played the violin for 10 years, which trains one side of your body way more than the other. It even points to things like old surgical scars, which can tighten up the connective tissue under your skin and create a pull. Any one of these can cause a subtle, nagging imbalance that forces your spine to curve just to keep you upright. Okay, so if those are the possible causes, what's the fix? Well, this is where we get to the core idea of HMGT, and it's this really clever combination of two ancient practices, but with a totally modern biomechanical twist. The whole technique is built on this amazing push and pull dynamic. It's like a balancing act. On one side, you've got acupuncture, which everyone knows is great for relaxing muscles that are way too tense. But then on the other side, you have moxibustion, which does the exact opposite. By applying targeted heat, it's used to contract and sort of tighten up these meridian pathways. So the core idea is simple but brilliant. Use one tool to loosen what's tight and another to tighten what's loose, all to pull a misaligned structure back into perfect balance. And that brings us to the absolute centerpiece of this entire system. To really get how HGMT works, you have to understand something they call the Hyunga axis. This is the key. So what is it? Think of the Hyunga axis as the true north for your body's core alignment. It's not something you can touch like a bone. It's a set of these key energetic pathways, or meridians, that run right through your torso. And here's the really groundbreaking part. The people behind HGMT found a way to actually trace these theoretical lines on an X-ray. That gives them a visual map to see if the body's core is truly centered or if it's twisted out of whack. And it gets even more specific. The axis is broken down into 5 different lines. Now, it's important to note, these aren't steps in a process. They're more like 5 different diagnostic maps. Line 1, the one right down the middle, is the big one for diagnosing pain. Line 2 can give clues about your organ health. And line 5, for example, helps show the body's overall external shape. Each line tells its own part of the story about your body's alignment. And this leads to a truly revolutionary idea. HEMGT says that your pain isn't necessarily coming from how much your spine is curved. It's coming from whether or not the central energetic axis is distorted. Get this. That means if that central line 1 is straight, someone with a really noticeable spinal curve might not feel any pain at all. And that just flips the whole goal of treatment on its head. It's not just about straightening the bone anymore. It's about realigning the body's true core axis. Okay, that's all super interesting, but how do you actually straighten an invisible energy line? I know, it sounds a little out there. So let's look at how this theory gets put into practice. The method is based on a concept they call glocalization, a mix of global and local. It's pretty cool. Instead of, say, pushing directly on the spine, HMGT practitioners use your arms and legs like long levers. By applying resistance at very specific points on your limbs, they can create a force that travels all the way up through those meridian pathways to correct a twist in your core. It's the definition of a small, local action creating a big, global change. Here is a perfect example. Let's say the goal is to target the lower back.
The practitioner might put gentle resistance on a very specific spot on the inside of the patient's ankle, a point along the spleen meridian. Then, as the patient tries to lift their leg straight up against that resistance, that force gets channeled all the way up that pathway, creating this corrective pull right where it's needed in the lower spine. It's incredibly precise and elegant.
So the big question is, does this stuff actually work? Well, let's take a look at a case study of someone who was in a really tough spot before trying HGMT. So the patient is a 60-year-old man, and he's not just dealing with a little back pain. He'd already been through disc surgery, and it had gotten so bad he was having a hard time just walking. This was a really chronic, severe case where the usual approaches just hadn't worked. And the results? They were pretty remarkable. After the HGMT treatment, you can see his central Hyun-Gai axis line went from distorted to restored. That functional leg length difference he had, gone. But here's the most important part. His chronic back pain completely disappeared. And this is the key. The treatment focused on realigning that invisible axis, and as a result, the symptom, the pain that was ruining his life, went away. So when you step back, you realize this is about way more than just a new way to treat scoliosis. What HGMT offers is a totally different framework for how our bodies work, period. It's a model where our physical structure, our energy, and our ability to function day to day are all deeply, fundamentally connected. And if you need one more piece of evidence for how different this approach is, get this. A full 80% of HGMT techniques are done with the patient lying on their back, face up. Think about that. So many other manual therapies have you lie face down so they can work directly on your spine, but HGMT flips that script entirely because it's focused on those crucial meridian channels on the front and sides of the body. And all of this brings us to one last question for you to think about. The next time you feel that ache in your back or that twinge in your neck, ask yourself, is it just a local problem right there in that one spot? Or could it be a global message from your body's entire system, a sign that your true central axis is out of alignment? The Hyun-Gai Meridian technique suggests that if we listen to the whole system, we might just find the answer.